Hi everyone, my name is Julia Santiago, and this is my visual narrative presentation entitled Behind the Uniform. Merriam-Webster defines uniforms as dress of a distinctive design or fashion worn by members of a particular group and serving as means of identification. In the hospital, you commonly think of scrubs as the uniform, but gowns are also uniforms. Gowns identify that person as a patient. And as it often happens when wearing a uniform, we not only designate that person to a certain group, but we often treat them in a certain way without consideration of them as simply a human being. This first photo is a common sight that you see in the hospital, a nurse smiling at her patient. We often don't think about what is going on behind the smile and the friendly face. Recently, I just had one of my most impactful moments in nursing when I had a patient that was very upset with me over the fact that I did not bring his pain medication early. I remember him asking me if I was mad at him, and I felt so bad because I felt like maybe I just didn't look happy enough or I lost that smile that I usually hold. So I told him that everything was fine, that I wasn't upset with him, and he just began to scream at me. He told me how much of a horrible human I was, that I didn't know what it was like to be in pain, and that I was treating him terribly. Normally, I would just apologize and leave as soon as I could, but that day I was just having a horrible migraine. I've actually struggled with migraine since I was in elementary school, and even though I could feel one coming on, I decided to go into work anyway and try to tough it out. I was just doing my best to take care of my patients and try to be as pleasant as I could be, and to be encountered with this patient who was just downright nasty, and to tell me that I didn't know what it felt like to have pain really upset me. And sometimes it's just easy for patients to forget that nurses are humans too. Just because we're at work in uniform with a smile on our face doesn't mean we don't have our own issues, our own emotions, and our own feelings. In this photo, it's another common sight of the hospital, an upset patient. This picture represents a patient that I had that had just had her left leg amputated and was what everyone had deemed ungrateful. The surgeons had assured her that if she did not have the emergency amputation, that she would die from an infection sooner rather than later. The surgeon actually came in and said, "We have to take it off tonight." She argued and refused for hours, but inevitably went to go get the surgery. So there she sat, being ungrateful. I mean, what's a limb compared to your life? Most people were considering her lucky that they found the infection and were able to get rid of the infected leg before it caused any more damage. That night when I had the patient, I was talking to her and she told me that she loved to dance, and she cried over the fact that she thought she would never get to again. Whether it's the woman with the new amputation that can no longer dance, or the patient with throat cancer and a new trach that used to love to sing, sometimes it's not the actual procedure or the diagnosis, but what it takes away from the patient that's truly affecting them. In this photo, we have a nurse that's doing postmortem care, an unfortunate yet common practice in the hospital. In this case, the photo represents me. I Although I cared for many recently deceased patients at the time, this one was particularly rough on me. I had a coworker that was helping me that actually mocked me for being visually upset and asked me, like, "What's wrong with you?" I just kept working. I was just too scared that if I spoke, my abnormally high hormones would make me cry, which is not a thing I like to do at work. I hadn't told anybody yet because I was very early on, but I was actually pregnant. And somehow it just didn't seem right to be surrounded with death when you're growing a life inside of you. It also just upset me that even though my coworker and I had worked together for years, that she would be that inconsiderate, that when she sees me visually upset, that she would tease me or mock me, even though we're taking care of a patient that had recently passed, and that's, can be an upsetting moment for anybody. In this photo, we have the representation of another patient that I took care of who was only 31. She had just gotten a terrible diagnosis of terminal cancer. There was nothing that the oncologist could offer her other than comfort measures and a timeline. While getting report, I was told not to turn on the lights and to leave the door closed when I wasn't in her room. They told me that she was very depressed, and who could blame her? Cancer is a terrible diagnosis, and she was so young. When I assessed her, I found that she was crying, and I started talking to her. And at first she didn't respond, but then she finally started to talk to me. And I told her that her diagnosis was very tough to deal with, and that we were there for her to support her in any way possible. And she actually explained to me that it wasn't the diagnosis that she was upset about. She actually shared with me that she wasn't worried about her own life, she was worried about her children. She had no living relatives, and their father wasn't in the picture, so she had no clue what was going to happen to them when she passed. And even though everybody just assumed that she was lamenting over her own life, she was actually just worried about her kids going to foster care, or who was going to take care of them, whether she could find a friend or somebody that would be willing to take them in. I shared some of these personal stories because I feel that they have an important message. Uniforms not only denote a position, but also lead us to assume we know more about a person than we actually do. Just because we know a diagnosis does not mean that we know the person. Just because a person is smiling does not mean they don't have pain. And just because we can see the emotions on someone's face does not mean we know how they're feeling. We have to remember that everyone is their own person, and we must treat them accordingly to keep the humility in nursing. Only through talking to one another can we truly understand what is going on behind the uniform.